Constipation, that's a big issue in America. And I was doing some research on it because my baby has some constipation issues. And if you want to start with the basics, you have to define it. But the problem is there's no good way of defining constipation, especially for babies. So the thing is, at the gist of most definitions of constipation is the fact that the person sought medical attention for constipation, meaning they think it's an issue. They feel constipated. In terms of how frequently you need to have a bowel movement, well, apparently up to a week is fine. And some criteria, have to have minimum, right? As in less than 2 bowel movements per week. But does it say that you could go a week without? Does that make it so you have constipation? No, because constipation isn't so much a medical diagnosis as it is a feeling. You feel constipated. And that's the thing for constipation. You may say, okay, that person, they have rock hard stool, they're constipated. And they may or may not feel that way, right? It's like this term dyspnea means trouble breathing. Some people look like they're actively having trouble breathing. They're doing what we learned in school as the classics, using accessory muscle, right? But they feel fine. Are they dyspneic? Are they having trouble breathing? Well, they don't feel it, so thus they're not. The thing with bowel movements is some people have harder, some people have softer. And my baby never had rock solid bowel movements, but so do most people in real life. I bet most people in the population who struggle with constipation don't have rocks that come out. They may have pellets, things shaped like a ball. I mean, my wife had balls come out, and she says, that's fine. I'm still pooping every day. So she's fine. She's not constipated. She has abnormal stool, but that doesn't make for constipation, right? So the thing is, when you have a change, right? And all of a sudden you're having a bowel movement every day, and now you're having once every 5 days, you may feel constipated. And most people allow that to indicate you are constipated. But does it work for everybody? For example, say I'm used to having bowel movements every 5 times a day, and I go half a day without. It's like, I feel constipated. I haven't had bowel movement in like 8 hours. Something's wrong. And people will go like, what's wrong with you? You don't have to have a bowel movement all the time, right? And that's the thing with constipation. It's not defined well. And how does it work for babies, right? I was looking at criteria for baby constipation, and basically there is none. People say, well, they're fed on breast milk, so they don't have bowel movement every day. Okay, yeah. If they're on solids, are they supposed to have a bowel movement every day? No, some people have a bowel movement every 3 days. That's fine. So when is it worrisome? There is no criteria. Except if they're crying when they're straining. See, straining in and of itself is also fine, apparently, because they just have weaker abdominal muscles. You need to put in force to push the stuff out. And so that's also fine. But if they're crying, then that's an issue. Encopresis. So you don't want them to have pain, but is that constipation, or is that pain with defecation due to something else? Like, do they have a tear in the anus? Do they have other reasons? And the funny thing is, if you have constipation, does it mean that you're supposed to have pain when you are straining? Or can you have pain even when you're not straining? My wife couldn't figure it out. I said, well, she's constipated. That's where her belly hurts. She's like, but she's not straining. Yes, but people aren't always straining. I mean, I see many patients in the hospital who are definitely constipated, and they're not straining. They just have belly pain. You get them to have a few bowel movements and they feel better. How does that make sense? Well, the idea I understand is that when you have organs in your body that are pushing, trying to move something along, and they can't actually move something along, then it's painful. Like a stone stuck in a kidney, or the gallbladder, or stool that's not moving, and your gut's squeezing, trying to get to move, and it's not working very well. That's painful. And they're not straining. right? Because straining is at the very bottom when you're trying to push it out. But I think this is only the first part of constipation. The first part is, what is constipation in babies and how do we deal with it different from adults? And that's the thing. Adults have so many medications, we sort of don't care about what happens to your gut. Just get it moving. Consequences, lactate dependent, that's not the biggest deal for me in the hospital. Who cares? But for babies, you have a whole long line of years to develop poorly. You don't want to do something to them that's going to be making them poorly off in the future. And also, many of these medications that we use for adults, laxatives that are over the counter, are not recommended for babies, and I'm not sure why. But we'll talk about that on the next video.